Hey everyone, I'm Charlie Burns, an infectious disease fellow at Duke University. Thanks for letting us present virtually about our project, Perceptions of South Carolina Pharmacists Toward Providing HIV Pre-Exposure Prophylaxis. I have no disclosures. And so briefly, we're going to talk about PrEP in the South, so HIV Pre-Exposure Prophylaxis, why pharmacies are a potential access point for PrEP, and then South Carolina pharmacists' perceptions on providing PrEP. So as we all know, HIV is still a big problem in the United States, with the United States Department of Health and Human Services launching the Ending the HIV Epidemic, with a goal of 75% reductions in new HIV infections by 2025 and at least a 90% reduction by 2030. This is especially important in the United States South, which comprises over half of new HIV infections nationally. And you can see the difference in rates there based on the darkness, how dark the red values are. And so one way to combat the spread of HIV is through HIV pre-exposure prophylaxis. And that is given as a once daily pill, and when taken correctly, it is highly effective at preventing the acquisition of HIV. However, the South, while being one of the largest areas of HIV transmission, is actually the lowest area of PrEP use. With South Carolina, one of the key states highlighted by the Ending the HIV Epidemic initiative due to the disproportionate rates of HIV in rural regions. In 2018, South Carolina only had 11.7% of eligible persons actually receiving PrEP care. And one of the potential barriers is limited access points to PrEP, where it's usually only offered at academic clinics, public health departments, or other STI, sexually transmitted infection care sites. Other locations have had a lot of success with alternative access points to PrEP. And so these have been feasible in things such as One-Step PrEP in Seattle, which is a single encounter for STI and PrEP care and lab testing, telehealth PrEP in Iowa, and pharmacist-driven PrEP in California. But really the limitations on what strategies you can use are based on state law as to who can provide PrEP and how it can be distributed. So our hypothesis was that focused on pharmacies, and our hypothesis was that by expanding PrEP services to pharmacies, we can increase PrEP access and use by persons at risk for HIV acquisition throughout South Carolina. However, the first step is really to determine whether this is feasible and acceptable by pharmacists and what needs they need for this to happen, especially for those practicing in the state. And again, this was really driven on success other states have had with providing, with allowing pharmacists to provide PrEP, such as California, as we just mentioned. And there's also a big interest in this among pharmacists within their own literature. But again, why pharmacies for PrEP? So the CDC estimates that 70% of rural residents live within 15 miles of a pharmacy, and 90% of urban residents live within 2 miles of a pharmacy. So they're really community facing, easily accessible, and well-known by patients, and patients are comfortable with them. Also, there's already pharmacist-centered PrEP education and drive for this within pharmacy literature. So what we did to learn more about pharmacists' knowledge, attitudes, and perceptions towards PrEP is develop a survey in collaboration with the Duke Initiative on Survey Methodology. And we distributed this survey through the University of South Carolina Kennedy School of Pharmacy professional listserv. And through them, we were able to reach about 2,400 unique emails. And from there, again, we were really looking at pharmacists' knowledge, attitudes, and perceptions toward PrEP. And our main findings were that respondents viewed PrEP as both effective and beneficial for their patients. They felt that pharmacies were an appropriate location to prescribe PrEP, and respondents were both ready and willing to prescribe PrEP if allowed. But now drilling down on those findings in a little bit more detail, we were able to get 150 responses, which is about what you would expect from an electronically distributed survey such as this. And the key takeaway here is that we had a great distribution of pharmacists from different practice locations, from rural, small towns, suburban, urban locations across the state. And we also had pharmacists from a variety of different practice types. So anything from academic, community, hospital-based, independent, retail, specialty, and unknown. The other important fact here is that there was a wide range of practice experience with a mean of 17 years, but a range from 1 to 50 years. So a lot of experience. And as far as the results go, most pharmacists, 67%, thought that PrEP was effective. And even more, 74% thought that pharmacists providing PrEP would be beneficial for their patients. Again, around about the same amount, 72% thought that pharmacies were an appropriate place to prescribe PrEP for patients. When asked about readiness and willingness, About 60% said they were ready now, at least somewhat ready now to prescribe PrEP. And 86%, so most of the respondents were willing to prescribe PrEP if they were able to. And again, you can see the number of respondents change for each question, as we didn't require participants to answer every question. They can skip any question they wanted. And we also asked about some of the barriers pharmacists saw to prescribing PrEP within the pharmacy setting. The biggest barrier was costs and patient insurance status concerns. And this one can be overcome with various patient assistance programs that exist to help patients afford this medication. And again, pharmacists are typically very familiar with medication assistance programs and navigating that type of system. The other issue is a lack of knowledge and comfort with PrEP, but again, there are educational programs through the CDC and within the pharmacy literature that can help educate and increase knowledge and comfort for PrEP for pharmacists. The third biggest barrier is, again, lack of time, and I think this will vary based on the pharmacy setting that the pharmacist is practicing in. But the lowest barrier really was PrEP side effect concerns, and I think this is because, again, a lot of the pharmacists we surveyed actually dispense antiretrovirals, so they're already familiar with these medications and the potential side effects and how to mitigate those. So the overall goal would be, again, if we can get pharmacist-driven PrEP, which is something I think we can do by increasing knowledge and comfort through educational initiatives, we can increase PrEP access throughout the state. And again, pharmacists are easily accessible and can cast a large net. And again, as the CDC had estimated that most people live within a short distance from a local pharmacy. And from there, we can increase PrEP use, but at first we'll need to figure out how to bridge the gap between willingness and readiness to prescribe PrEP. And ultimately, if we can increase PrEP use, we can decrease HIV transmission, with the final barrier being reimbursement strategies to help pay for these services in pharmacists' time, which need to be addressed by the state. And so this project had been funded by the Duke University Center for AIDS Research, and I had received training grant through an NIH T32 grant. And our whole team here is made up of persons from both Duke University, the Initiative of Survey Methodology, and the University of South Carolina. And with that, I thank you for your time.